Hello everyone, my name is Cheryl Masangid and I am from BSN2A. This time, I will be performing a return demonstration regarding on how we will going to administer a vaccine using the oral, intramuscular injection, intradermal injection, and lastly, subcutaneous injection. But before I am going to proceed, let's identify first what is the importance of vaccination. Vaccines is very important and crucial. It is because it protects you from any contagious or dangerous diseases. It also helps to reduce the morbidity among infants and children, in which this is administered to induce immunity, thereby causing the recipient's immune system to react to the vaccines that produces antibodies. By this time, we will be administering an oral vaccine. So this is a vaccine usually done through the mouth, and it is the most convenient and comfortable route among children. So the kind of vaccine that is done through the mouth is we have the oral polio. So oral polio, it is administered by drops. It is a type of vaccine that contains live attenuated viruses. It should be done in 2 doses, and the site would be the mouth. In administering a oral polio vaccine, make sure to prepare the materials that you need. So we have here the hand hygiene equipment, or the ABHR. We also have the sterile gloves, and we also have here the vaccine. So let's just assume that this is a oral polio vaccine. May buntag, ma'am. Ako din yung student nurse karon, ma'am. Akong pangalan kay si Cheryl Masangid. So nag-eskwela ko, ma'am, sa Davao Oriental State University. So karon, ma'am, mag-administer ko sa imong baby og oral polio vaccine. So kanina vaccine, ma'am, mahitabo ni siya gamit or administer ni siya, ma'am, through sa baba sa baby. So dili ka nga problema, ma'am, kay dili mo na pinaka-convenient o comfortable nga vaccine para sa imong baby. Okay lang ba, ma'am?
Yes, ma'am. Okay lang.
Always remember that establishing rapport towards your client is very important. It is because it allows you to gain their cooperation and also for them to be comfortable. After introducing yourself to the client, make sure to prepare the materials or the vaccine that you need. So as what you can see earlier, I already prepared the vaccine. So here it is. So in administering a vaccine, make sure to prepare and identify what vaccine are we going to use in order to reduce or to decrease the risk of administering the wrong one. I'm done performing a hand hygiene already, so I will be using a ABHR right now in order to ensure that there is no risk of infection and cross-contamination. After gathering the materials or the supplies that you need, make sure to close the door or cover it with curtains. So since I already closed the door, so this would allow the patient to have a privacy and of course to feel comfortable upon administering the vaccine. So ma'am, karon ang ato ang i-administering vaccine kay oral polio, ma'am, no? So ma'am, muhang baby, ma'am, ano yung pinaka-first shot kay magka-oral polio? Sige, name, ma'am.
Kevin, ma'am.
So, ano yung first dose, ma'am, ha? In verifying a vaccine administration, it is very essential. It is because it would help to ensure the accuracy of the vaccine that you are going to administer, and of course to avoid errors in administering what type of vaccine. After that, perform a hand hygiene and of course wear a sterile gloves in order for us to reduce the risk of infections and cross-contamination. Attach the dropper to the vial and make sure that you are not touching the cover of the dropper in order for it to be not to be contaminated. So let's just assume that this is a dropper and we have here the vial. So let's just assume that we are already opening this one, the dropper, and hold the vial. Make sure that the opening of the dropper is not being touched by your hand to avoid contamination. Always remember that if you are administering a lot of vaccines, make sure to administer first the oral vaccine. It is because this time the infants is still calm and you can still adjust and make the infants more comfortable first before administering a injection type of vaccine. Make sure to administer first the rotavirus vaccines before the polio vaccine. Make sure to assist your patient in its most appropriate position. This could be done in a cuddle way in order for the infant to feel more comfortable and calm. Open the infant's mouth and make sure to squeeze its cheeks carefully using your one hand. So let's assume that this is a oral polio vaccine. So make sure to give 2 drops of this in the tongue of the infant. Open mouth, baby. And make sure to eventually discard the dropper or the tube in order not to increase the risk of infection or contamination. And also make sure to remove your gloves and perform hand hygiene. After administering the vaccine, make sure to document the procedure and the findings. So having a proper documentation will help to ensure the client's safety. So make sure to document the date, the location, and of course the time of your vaccination. And that would be all for oral vaccination. And since we have 2 vaccines that are done through in the route of the mouth, so we have the rotavirus and the oral poliovirus. So as what you can see in this procedure, I have performed the oral polio vaccine. After that is the rotavirus vaccine. So a